What's up, everyone? This is Dr. Webb here. Today I wanted to do something a little bit different. I always talk about the positives and the pros of going into medicine. And my channel, my page, YouTube page, is mostly motivational, inspirational, to try to encourage you guys to go into medicine. But I want to do something different today. I wanted to go over the cons or the disadvantages, the downsides of becoming a doctor, because there's a lot of them and you just don't hear about them. When I was growing up, I always hear about the good things about doctors, and they made all this money, they lived this glamorous lifestyle, white picket fence, drove nice cars, they looked great from the outside. But until I actually got into medicine, I actually started realizing there are lots of disadvantages and downsides of becoming a doctor that a lot of people just don't talk about. So here we go. I think, number one, it's very time consuming. You will be training and in school for a long time. 4 years of college, 4 years of medical school, and anywhere between 3 to 9 years of residency, depending on your specialty. Versus someone who is graduating from college, like your colleagues or your friends, they go from college straight to work, or not even go to college and make a lot of money. So it definitely takes a long time of schooling, of education and training, and it's also a lifelong. It's not like once you get done with residency, your studying or your education ends. It's lifelong, and that's kind of pretty much with any job that you go into. With that being said, it requires a lot of sacrifice, and you have to sacrifice from your friends, from your family, going on vacations, going out with your coworkers. A lot of things have to be put back on the back burner. You may miss games with your children. You may miss important events. You may miss weddings of coworkers and best friends. So you have to make sacrifices, and I think I made a lot of sacrifices. I lost a lot of friends along the way who just couldn't understand why I needed to study for 12, 14 hours a day. That's what it takes. It requires sacrifice. Next, I think physician burnout rate is very high. Medscape every year puts out an article and they talk about burnout rate, and it's very a hot topic in medicine and the news lately because of physician suicide. And a lot of people don't talk about this, but suicide rate is actually very high within physicians. There was a study in the American Journal of Psychology that actually noted that physicians have a higher suicide rate than the general population. And they stated that about 300 to 400 doctors kill themselves every year. So you don't hear about this a lot. It's just because of the stress level, the lots of responsibilities, lots of different factors that can go into that. But physician burnout rate is extremely high, especially in emergency medicine. They even said internal medicine, family medicine, those have really high kind of burnout rates. Like I said, it can be very stressful. You're under a lot of responsibility. You have a lot of responsibility. You're scrutinized from everything that you do is scrutinized. So that presents itself as a lot of stress for a lot of different people, and that can lead to a lot of different things. Next, I would say it has a lot of politics in the medicine. Everything that we do, from the way we care for patients, the way we get paid for surgeries, the way we open up hospitals or do things in the hospital, politics is involved. And when politics gets involved in medicine, I think that presents a problem. I think those two are too intertwined, and I think that presents a lot of problems, especially when trying to get paid for things that you do. A lot of doctors don't feel like they're fairly compensated, just dealing with the insurance companies and constantly fighting with the insurance companies to get paid for procedures that you do or patients that you see. I just hear about the complaints and how doctors are frustrated with it on a daily basis. So I think in summary, medicine is a good field to go into, but there are some downsides, some disadvantages. Like I said, it's very time consuming. You'll be in school for a long time. I didn't mention this, but you will have a lot of debt. The average student comes out with about $200,000, $300,000 in debt. It is very stressful. A lot of specialties, some specialties are more stressful than others. It requires a lot of sacrifice. You have to sacrifice friends, family, vacations, time with your loved ones. And also there's politics that's involved with it that can play a factor and can add to the stress level. So I wanted to give you guys a whole picture and instead of just telling you guys that medicine is very glamorous, you have this nice lifestyle, you'll get paid all this money and live a happy life. That's not the case, because reimbursement rates are decreasing, physician compensation is decreasing. Physicians are doing lots of different things that are not necessarily in the best interest of the patient, just to make money or make up for the money that they lost in compensation for reimbursement, which can lead to substandard medical outcomes. So I want you guys to consider the whole picture. I personally think it's still worth it to me. But any physician or any job that you go into, you're going to have some downsides, some cons. So, but I think it's important for you guys to kind of weigh both sides of it, and just think about those downsides when you're applying and when you're going through the process. This is Dr. Webb. Contact me at overcomingtheoddsbook@gmail.com if you have any more questions, or on my website, AntonioWebbMD.com. Thank you, and see you next time.